go into the basic mode. Now we choose the area that we want to treat. So we go into the axilla. We have, of course, female patient. So I go into the next step. You can see our patient have really light color of the skin. So we can connect this to the skin phototype 2. Then I go into the thickness of the hair. So this is really important. If you shade the area before, please ask first time if your patient come to the clinic to leave a little small amount of hair to see the thickness, the density, and of course the color of the hair. On the axilla was really thin, so this is why I choose 1. The next step is the hair color. You can see the hair before was brown, so I choose the number 2. And now I go into the density. As you remember, density it means how many hairs or how big amount of hair you have on the treatment area. So for example, I will choose 1 because I don't have so many hair. Next step is to choose the type of mode that you want to perform, paint or step. I will start with the stamp mode to show you how it will looks like. Then I will show you on the other axilla how it works with paint mode. So now I have my screen, so I can see the fluence, so the energy that I will perform on the treatment area. You always have possibility to change the parameters, so it's around 5% between the highest and the lowest one. Then I can choose the repetition rate, so how fast I want to perform the treatment. My recommendation when you do the first time treatment, use single. Why? Because single, it means that you need to trigger every time on the bottom or on the foot switch. So it will be easier for you to control and to know how the device will work. If you are more advanced or it's not your, for example, first session, you can go to the interval and choose how fast you want to perform the treatment. But my recommendation is to use, for example, 1 or maximum 2 Hz. So now I will put my goggles on my eye area and I will perform the treatment. Please remember to be careful because now I will working on the bottom on the handpiece. So this is really important if you take the handpiece to not push the bottom because you will start the emission of the laser. So always remember that you have hanger that will help you to keep the handpiece in right position and to not fall down the handpiece. This is really important. Now I will put my handpiece on the treatment area, start moving to really cool down the treatment area and to show my patient how the cooling system working. So when I am sure that my area is cooled down, I can start. First, little press the handpiece and then start emission. And always stay your patient that you will start the treatment, that they will not be scared of the sound and the shot. So I will start my treatment. It's okay. And then you move. Be very precise during the procedure to not make any kind of space during the treatment. If you are not sure where you was, you can repeat it in the second treatment. So as you can see, I need to press the button all the time when I do the treatment because I choose the single repetition rate. Always ask your patient that it's okay for them, if they feel comfortable, everything is okay. So be in contact with your patient all the time. Remember to press little the handpiece when you are doing the treatment to always have the full contact with the treatment area. When you finish your treatment, take away the handpiece from the treatment area. Remember to not push on the button. So first remember to push the button on the screen. Now you are safe. And then remove the handpiece. Please remember to clean the handpiece before you put to the calibration port. This is really important to not make this place dirty. So this is why have always very near your area paper towel to clean the port, to clean the handpiece, and to avoid any kind of problem. So this is why I always recommend you to have the paper towel, and even if you don't have time now to clean the handpiece, put it with the paper towel like this, and then come back to clean the handpiece fully and disinfect. Now I will start to clean my patient area that we just finished with the stamp mode. As you can see, we have some kind of points of burned hair. So what it means? That the treatment was effective. So I hope my patient enjoyed the treatment. As you can see, she really liked this. Now we will clean the treatment area. So we remove the gel. This is really important to have clean and dry area. You can use for this cotton pads. But what is my recommendation, especially when you are working on very big area, to take the wood spatula and take away the rest of the gel and then remove with the paper towel. It can be easier for you and faster to remove and to clean the treatment area after the treatment. When you finish cleaning the treatment area, you can put ointment. We recommend you to put any kind of ointment that you can use immediately after lasers. For example, even with the zinc, to have soothing and faster healing effect. Now I finished my axilla, so we can start with the other one. So our patient can put the hand down, and I will start with the other one. So I will prepare everything to show you how to start with the paint mode. What is really important, please, if you even do the treatments, to never do two different modes on one treatment area.